What's going on, everybody? It's Dr. Pallavi again on a Friday afternoon. I just finished up a case in the OR, and I wanted to talk to you all about a very common topic that I talk to about my patients who are about to go under anesthesia, which I figured you all would benefit from. And that topic is the risks of having surgery. So, what exactly entails surgical risk? A lot of patients undergo surgery but don't really know why is surgery considered risky, or rather, what risks of surgery are important to consider when you're about to go under a procedure. So when I advise patients about risks of surgery, we usually talk about three different categories. The first one, of course, is the nature of the surgery itself. And generally, anesthesiologists and surgeons, when they plan a case, they discuss the different types of surgery and the three different stratifications or levels of risk of surgery. That can be broken down into high risk, intermediate risk, and low risk. And that really depends on what kind of risk the body's vital organs are exposed to during that procedure. So what are the vital organs? Well, with respect to surgery, it's mainly the heart, the lungs, and to a certain degree the liver and kidneys, because those are our main metabolizers of medication. But the heart and lungs, of course, are important for your ABCs, airway, breathing, and circulation, basically being able to not only keep your body alive, but allow it to undergo the stress of surgery. So what does that mean? Well, let's talk about high-risk surgeries. High-risk surgeries are those that will put you at high risk of putting those organs at jeopardy. Because heart surgery and lung surgery are surgeries on those vital organs, those of course end up being the riskiest surgeries that we have to be concerned about. Other surgeries, vascular surgeries, major surgeries like liver and kidney surgeries, which can be in that high risk as well, because again, these are vital structures that are important for sustaining life. Then we move to the intermediate surgeries. Intermediate means not necessarily putting the vital organs at risk, but still put a great deal of stress on the body. So if those vital organs are not in good shape, then that can cause a problem during surgery. And these types of surgeries are neurological surgeries, major orthopedic surgeries. So for example, a total hip replacement or a spine surgery. These are considered intermediate surgeries. Any type of abdominal surgery, for example, even something like gallbladder removal or a colon surgery, these surgeries are considered intermediate risk. And then the lower risk surgeries are ones that are more superficial: eye surgery, dental surgery, any type of skin procedure, some urological procedures, things like colonoscopy, endoscopy. These are very superficial and put minimal risk to the vital organs, and therefore they're considered low-risk procedures. The next category that we assess in terms of surgical risk is actually the patient's condition. So if a patient is very healthy versus a patient who is very sick or has a lot of comorbidities or diseases, that's also going to be factored into the surgical risk, because it is the organs such as the heart and the lungs that allow us to endure, as I previously said, allow us to endure the stresses of surgery. So if a patient comes in and they have coronary disease, meaning their heart's weak, or if they have a heart attack in the past, these patients are considered major risk. Anyone who has lung issues or has trouble exchanging oxygen and carbon dioxide, they're going to have problems being on the ventilator, and therefore that can be problematic and put the patient at additional risk. Other problems are bleeding problems, clotting disorders. That's going to put the patient at risk for poor wound healing, which will then again result in possible surgical complication risk. Similarly, diabetics are considered at higher risk for surgery because diabetics, if they're uncontrolled, have poor wound healing, have comorbidities like metabolic syndrome, heart disease, lung disease. These can be problematic when recovering from surgery. And then the third component, my component especially, is the anesthesia risk. So what you may have heard is that anesthesia these days is relatively safe. Actually, that is true. That is, they're extremely safe. And in previous videos and my posts, you've seen I describe different categories of anesthetic medications. But the things, and so each one of those poses a different kind of risk. But overall, these medications have a very safe side effect profile if administered in correct doses. So that a lot of that depends on the anesthesiologist and the anesthetic strategy. Things to consider: length of anesthesia can pose a higher level of risk. The different kinds of medications, even though they are relatively safe when used appropriately, there's still side effects to everything, and those have to be considered. Specifically, if a patient is allergic to something, or if they develop or they have an unknown allergy, then if you have an allergic reaction to an anesthetic medication, then that will obviously present risk during surgery. Other things, and some anesthetics can affect the heart, the lungs. There are certain reactions you can have to anesthesia, something called malignant hyperthermia, which is a fairly rare reaction, but it can be deadly if it's not handled properly. But that's a very, very exceedingly low risk, one in the millions, and therefore, and anesthesiologists are well trained to deal with those kinds of situations. Nonetheless, these are some of the things that have to be considered when assessing anesthesia risk. So in summary, the risk of surgery is threefold. The actual level of surgery, meaning how complicated the surgery is, how involved it is. Then the patient's risk level, meaning how healthy or how unhealthy is the patient, specifically with respect to cardiopulmonary disease, diabetes, or if there are any hematological conditions that would affect bleeding or clotting. And then there, of course, is the anesthesia risk, what kind of effect that has on the body's organs. These are the three major categories that should be considered when someone is trying to assess that surgical risk. And that's what the anesthesiologist and the surgeon typically do together prior to your surgery to assess what the outcome will be. Anyways, that's my explanation of surgical risk. I hope you found this video informative. As always, feel free to send me a message or drop a comment down below. If you like this video, please click that like button. It helps us get the word out. Share it with your friends so that they can also understand what surgical risk is. I look forward to seeing you in the next video. Have a good weekend.